Hello and Assalamu alaikum, ladies and gentlemen. Thank you for joining us for another podcast interview. Today we have Dr. Amber Kiyani with us. I'll be introducing her firstly. Dr. Amber Kiyani did her BDS from Rifa International University. She then later did her master's in oral biology and oral maxillofacial pathology from the Ohio State University. She's currently serving as a consultant pathologist at the Islamabad Diagnostic Center, and she's also serving as assistant professor at Rifa International University. Thank you so much, ma'am, for joining us.
I'm happy to be here.
Thank you so much. Firstly, once again, finally, we get to do this interview. Light bhi chali gayi meri. It's been all over the place, but I'm so glad we get to do this and we get to talk a bit about maxillofacial pathology. Firstly, for our audience, I didn't know about Dr. Amber personally, but I listened to one of her lectures at the PADR PPA conference a few months back, and I was at and one of the best lectures at the conference. So I knew I had to interview her there.
Thank you very much. That's very kind of you.
Thank you so much, ma'am. So with your permission, should we start the interview?
Please go on ahead.
All right. So first question, just a simple one. Tell us briefly how you got into BDS, how you got into dentistry, and what were those undergraduate years like?
So back in the day when we were small, we didn't really have choices in deciding our careers, okay? So our parents decided what they their kids to be. So my father decided that he wanted to see kids in a white coat. By that time, the other two had graduated, so I was the only one left.
Okay.
So that's it.
All right.
Here
So,
I am as a dentist now.
all right, perfect. That's a simple little story. Okay. So
Yeah, that's a little story.
what made you choose a career in oral pathology? Now, this is not a career many choose, but what made you choose it? Was it like bas mil gayi, you got admission into Ohio State? How, like, did you apply through the match process, or how did you apply, and what made you choose oral?
So oral pathology, goes through the match process, and I honestly really wanted to do oral path. I was one of the lucky people who had an oral pathologist teach them during university.
Okay.
Dr. Joharia Azhar had just completed her master's, and she came back, and we were her first class that went through. And I really enjoyed the subject, that you can pursue a whole career in it. I started my own class. And there were a few who responded very positively, and they were eager to, just get in touch with me. And I kept in touch over a couple of years until I was done. I completed my house job and then applied to the programs, and I got in.
Wow, that's brilliant. But what?
So I was completely passionate. Everyone told me I was being stupid. Everyone told me FCPS Part 1 ka exam do, training karo. But I persisted. This is what I wanted to do.
That's amazing. अगर आपको एक subject अच्छा लग जाए, so what more could you want कि आपको एक चीज़ में passion और फिर आप उसी को pursue करें. That's the ideal thing anyone can pursue. But ऐसा क्या आपको maxillofacial pathology में या pathology में आपको जिससे आपका passion पैदा हुआ? What was that one thing?
Me thing about my job is I see something new every day, something I have not seen before, and I'm the kind of person who likes learning on a daily basis. By the way, मैंने practice repetitive and to the dentist there. It was wanted to. So in that respect, I think my current field of work keeps me very entertained on a daily basis. I'm looking up answers, I'm looking up papers, looking up who's seen what, discussing cases with other people. So yeah, it's just very interesting that way.
Oh, that's interesting. That's great. All right. What does a day in the life of a pathologist look like? Just
okay. I can start with calm. But I'm a morning person, so I wake up early. I get to the lab in the morning because I want to, get most of the stuff done before I start my day at the university, because I teach and I practice. So then I start my day at the university, which requires teaching and all the administrative tasks. I get done from the university around 3. If I have work at the lab still, then I go back to the lab. If I don't, like today, I can take some time off and I can relax. So this is like me time. So it's not that busy, but it's not completely free as well. But yeah, it's just somewhere in between.
Alright, so it's just somewhere in between. अच्छा, तो मैंने आपसे ये पूछना था that not every pathologist ends up working in a lab and a teaching job. And सबसे पहला सवाल लोग यही पूछते हैं कोई भी career path choose करने से पहले कि scope क्या है. So हम हर बंदे से पूछते हैं सर्जरी का क्या स्कोप है, ऑपरेटिव का क्या स्कोप है, प्रोस्तो का क्या स्कोप है, और हर टीचर का एक डिफरेंट जवाब होता है. ओरल पैथोलॉजी, मैक्सिलोफेशियल पैथोलॉजी या जनरल पैथोलॉजी का पाकिस्तान में क्या स्कोप है?
देखिए, जनरल पैथोलॉजी का तो स्कोप है, ठीक है, इसलिए बिकॉज पीपल विल कीप गेटिंग गॉल ब्लैडर एंड दे आर गोना कीप गेटिंग देयर अपेंडिक्स, ठीक है ना. However, oral pathology, we're building it up, ठीक है, we're building up as we go on. Like my first paycheck, and I think I'm reminded of that very often in the past few months for some reason. मेरा जो पहला paycheck था IDC से, it was 800 rupees after 2 months.
Okay,
which means I did a total of 2 biopsies.
yeah, okay.
Building up a service from there has taken about, I've been in this for about seven plus years, ठीक है ना, और अभी भी मैं लाखों में नहीं कमा रही हूँ, ठीक है ना, but it's just my teaching job gives me my income, and then my service kind of gives me the extra money I need for travel or something else.
Alright, so Dr. Amber, हर बंदा ना अपना सब्जेक्ट पढ़ के कुछ सीखता है. For example, surgeons कुछ सीखते हैं अपने उससे. What has been your biggest learning outcome out of studying pathology in depth? It's a career not many go into, but आपको pathology पढ़ के and specifically maxillofacial pathology पढ़ के क्या आपने सीखा है?
कि हम completely बेबस होते हैं in front of God.
Yeah.
That's one of been my biggest learning. There are patients that go in for surgery with a T1 tumor, which means it's like really tiny, okay? And you're thinking that you're going to remove the disease and the patient's going to live like tens of years after that, and they pass away from a surgical complication. And then you have someone with a T4 tumor and they live for years. That kind of tells you how little your existence means in the grand scheme of things. But that's been my biggest learning.
That's a very brilliant answer, but a short and crisp answer. No, but you're absolutely right. All right, so this was the topic, this was the heading of your lecture at the oral and maxillofacial surgery conference at King Edward. A Stitch in Time Series 9. And I absolutely loved it. But and when I read A Stitch in Time Saves 9, I don't know what this means. What would the lecture be about? But when I listened to the lecture, it was amazing. So just for our audience, could you elaborate a little on this?
Yes. So I like reading a lot of classics. So I'm a lot of into this old English proverbs and everything. I find them very interesting. Yeah. So this one in particular means that, it's a sewing reference. Okay. So if a fabric is falling apart, okay, and you don't stitch it up at the right time, then the whole thing is going to fall apart. Okay, and you're going to lose the entire monetary value of that fabric.
Oh, you should have given this. You should have given this analogy at the lecture as well. But now it makes more sense.
I did, but I tried to make it really brief because I tend to, make my talks more. Relatable to
clinical. Yeah, no, I get it.
Yeah, more relatable to the people who are sitting in front of me. So I understand that they have different interests than me.
Yeah.
So that's why I try to keep things simple.
Yeah. No, but elaborate ये मैं कह रहा हूँ और audience के elaborate करें कि किस तरह से आपने उधर बताया था cancer में एक.
Okay. So I use this analogy and I linked it up with diagnosing oral pathologies at the right time. Because we have a very narrow window to save the patient, to give them a better prognosis than than what could happen.
Yeah.
So in that small time, it is our duty to make sure that the patient gets the best treatment possible. Absolutely. And if we miss this window, then there are going to be very dire consequences for the patients.
Yeah, absolutely.
And
Right. So in our country, Dr. Amber, maxillofacial surgeons or maxillofacial pathologists या oral pathologists, they don't work in cognizance जिस तरह से काम करना चाहिए और या you see in different in America भी जिस तरह pathologists और surgeons बहुत closely काम करते हैं, यहाँ पर उस तरह से काम नहीं करते. Closely एक close knit network नहीं होता कि आप बस biopsy भेज देते हैं और वो biopsy वापस आ जाती है, वो एक result पढ़ के और उस पे surgery plan हो जाती है. What can be done to change that?
I think one of the reason for this is that we don't really have a lot of practicing oral pathologists. ये एक problem रही है हमारे system के अंदर कि हमारे यहाँ oral pathology is considered a non-clinical field. ठीक है, जिसका मतलब है कि आप oral pathology का text जो है वो जरूर पढ़ा देते हो for someone getting a master's degree, but they don't really have experience in the field, not clinical, not histopathological.
Okay.
And this is primarily the reason why oral surgeons or oral pathologists का वो bond नहीं है. The bond that you're talking about, I do share it with majority of the people जो मुझे biopsy submit करवाते हैं, ठीक है? There are a lot of times when they call and they say कि नहीं डॉक्टर अंबर आपने ये कहा है पर मुझे तो ये दिख रहा है, ठीक है, आप इसको रिव्यू करें, ठीक है? And that's important information for us too, because हम इतना सा पीस देख रहे होते हैं उस पैथोलॉजी का, सर्जन ने वो पूरी चीज देखी होती है, उसने पेशेंट को फॉलो अप किया होता है, उसने पेशेंट की सिम्टम्स देखे होते हैं, उसने पेशेंट्स का पूरा जो है हिस्ट्री ली होती है, ठीक है? तो दिस काइंड ऑफ इंफॉर्मेशन गोज अ लॉन्ग वे. सो आई थिंक आहिस्ता आहिस्ता अगर हिस्टोपैथ जो है वो करिकुलम का पार्ट बनती जाएगी एंड विल हैव मोर पीपल हु आर प्रैक्टिसिंग ओरल पैथोलॉजी, ये लिंक बनना शुरू हो जाएगा ऑटोमेटिकली.
ऑलराइट, that makes sense. Okay, how can someone like me or a fresh grad or an undergrad be better at diagnosing and actually identifying oral pathologies? Now oral pathologies identify karna because all of them, a lot of leukoplakias and different types of erythroplakias would look the same.
They look the same. I'm totally agreeing with
even
you.
For me, everything looks the same. So how can someone be good कि अपने आप को clinically एक बेहतर कर सकें इस regard में?
अच्छा, so एक चीज जो डेंटिस्ट की बहुत ज्यादा होती है ना, और वो quite honestly मेरी अभी भी हैबिट है कि हम सिर्फ दांतों को देखते हैं, ठीक है? आप किसी से पहली दफा मिल रहे होते हैं and you're like class 3, ठीक है? Midline shifted है. It's natural because it's your profession. That's something that you're going to do naturally. So step number 1 is look at the mucosa as well as the teeth. Okay, I don't want a diagnosis. I want you to know if something looks different than it should. That's all you need to do. Okay, if you can find a reason for why it looks different, well and good. Okay, if you cannot find a reason for that difference, refer it out. That's how you do the best for your patient.
For your patient.
Okay? Yeah. Yes, all you need to know is ये normal है, ये नहीं normal है, ठीक है? And I need to refer this thing out. And then somebody else can figure out, maybe look at the specifics, history देखे, ठीक है? Maybe biopsy कर ले. If you can do a biopsy, that's great, ठीक है? But if you can't, then that's what you do. मेरा phone जो है on a daily basis images से भरा होता है मेरे students की, ठीक है? मैम हमने ये देखा.
Okay,
that's really
good.
So that's good.
That's really
like
good.
they know they need to reach out and they can't do this themselves. So that's all. We all have limitations, including me. I don't know everything. जैसा मैंने कहा है, see something new on a daily basis. So, yeah, so we all need help at times.
Okay, so this is a very interesting question that I always wanted to ask a pathologist, and I know you're the right person to ask this. No, you are, I know, because I listened to your lecture at the PPA conference. It was about artificial intelligence. Now, हार्वर्ड की या स्टैनफोर्ड की एक स्टडी हुई थी जिसमें उन्होंने टेक्नोलॉजी कहाँ जा रही है हेल्थ केयर में उसको असेस किया था. फिर उनकी फाइनल जो रिजल्ट था वो ये था दैट टेक्नोलॉजी वोंट रिप्लेस डॉक्टर्स बट डॉक्टर्स विद टेक्नोलॉजी विल रिप्लेस डॉक्टर्स. सो एक बहुत बड़ा कहा जाता है कि पैथोलॉजिस्ट और रेडियोलॉजिस्ट का काम आगे जाके बहुत कम हो जाएगा, या इन माय ओपिनियन लाइक एनी अदर फील्ड वो फील्ड इवॉल्व कर जाती है. पैथोलॉजी भी इवॉल्व कर जाएगी, रेडियोलॉजी भी इवॉल्व कर जाएगी. आपका क्या मानना है? बिकॉज आर्टिफिशियल इंटेलिजेंस यूज करके बहुत सारे जो टाइमिंग के मसले हैं, ये स्टिचिंग टाइम सेव्स 9, बायोप्सीज बहुत जल्दी डायग्नोज कर लेता है सॉफ्टवेयर. How will pathology evolve, and what is your opinion about all of this?
I do think कि टेक्नोलॉजी के साथ हमारी सारी की सारी फील्ड्स, इवन डेंटिस्ट्री जो है वो मेजरली इवॉल्व करेगी. ठीक है, टेक्नोलॉजी, इट्स नॉट अ progression that you can stop, but you can jump on the bandwagon right now. ठीक है, और हमारे पास by the end यही option रह जाएगी. I don't see this happening within the next, say, 5 years, but I do see this happening in the next 10 years. Okay? And it will really help. Pathologists are humans, so they make mistakes. Computer programs are not human, okay? And they can do something repetitively a lot quicker. Okay? And so they don't make mistakes. For me, knowing that something is watching over me, ensuring that I don't make the right diagnosis, I think that's going to be great.
Yeah.
Okay? कि मैं कंफ्यूज हूँ, ये benign है, malignant है, ठीक है, वो अपने सारे डेटा से process. That's like talking to someone who's really, really smart, who's seen like everything. ठीक है ना? You can just get a second opinion, and I think it'll be great. Even for radiologists, ठीक है, कितनी ज़्यादा चीजें हमसे miss हो जाती हैं radiology के ऊपर.
बहुत सारी, yeah.
ठीक है, exactly. And computer जो है वो fine details जो है वो notice कर सकता है, and it's. Yeah, I think this is going to be the future of all of medicine or dentistry.
Yeah. मैं अभी recently एक research article पढ़ रहा था where I think 60 or 70% के कोई results थे, I don't remember the results सही थे, कि early head and neck cancer diagnosis के लिए, which is very important. Early diagnose ही नहीं होती, ये सबसे बड़ा मसला head and neck cancer का, ये early diagnosis नहीं होता. तो वो भी artificial intelligence के through बड़ी उसमें अच्छी research लिखी हुई थी. I can't remember the research name exactly, but yeah, you're right. AI is the future, and hopefully all fields will be able to evolve, and
it takes away the human element from these fields, which is there, of course, because we're all human. However, but because the computer is not human, then we can take advantage from that fact.
Yeah. All right. So you're an assistant professor. आप students से interact भी करती हैं, आप students को पढ़ाते भी होंगी. Do you feel like there's a lack of career counseling in our field? कि बच्चों को, एक बच्चा जो ग्रेजुएट होता है उसको पता नहीं होता कि उसने अब आगे करना क्या है, उसने अब like what his or her passion is, कहाँ जाए, किससे बात करे, how to start a clinic, something as simple as how to start a clinic. And अगर है तो फिर उसको, how can that be changed?
Okay, so career counseling has been an issue back in the day when I was doing all of this. वो तब भी वही issue था, ठीक है? However, I think if you reach out to your professors, you're going to be surprised at how much they have to share. Like जब बच्चे मेरे पास आते हैं, मेरे experiences के बारे में पूछते हैं, I have a lot to share from my journey, right? It's going to be similar for any professor that you approach. ठीक है? Usually what I try to do for my students is कि हम थोड़े talks जो हैं वो arrange करवाते हैं. ठीक है? मेरी कुछ friends जो हैं, they chose fields which were slightly outside dentistry as well. ठीक है? तो हम उनको भी invite करते हैं. ठीक है? हम private practitioners को invite करते हैं. Of course उनके पास हमारे होते हैं जो professors होते हैं, वो उनके पास easily approachable होते हैं. So we try to offer options to our students, ठीक है? लेकिन the best way to do this is to reach out to someone that you want to be like, and start a conversation, ठीक है? And it goes a long way. I ended up where I am, even in the pathology program, because of motivation from Dr. Adnan Aslam and Dr. Faisal Moin. You know, these were my profs back in the day, ठीक है? And Dr. Noin Arshad, I shouldn't forget him. Like, these are people who pushed me all the way until I got there. Wow. Okay, they wrote my letters of recommendations. They even spoke with my family. जो मेरी family जो है वो थोड़ा सा वो कर रही थी कि जो है कि हम भेजें कि ना भेजें. They even spoke with my family.
Oh, that's wow. ऐसे professors मिल जाए तो बस फिर student को और क्या चाहिए?
तो ऐसे professors होते हैं, आपके इर्द-गिर्द ही होते हैं. I think you just have to reach out to them and you have to express your interest.
This whole platform, Dental Talk, मैंने अपने सर के पास गया था, डॉक्टर नासिर सलीम, and अगर वो मुझे उस दिन कह देते कि ये क्या फजूल आइडिया है, तो मैं शायद ये कभी भी ना करता और स्टूडेंट्स इससे बेनिफिट ना लेते.
कितना अच्छा आइडिया. अब so many people will learn about so many new fields that are out there. और जो मैं कह रही हूँ कि diverse fields होती हैं. I have friends जो CSP officer बन गई है dentistry करने के बाद. She's my classmate, ठीक है? I have another one who's running a baking business in Lahore. Oh, wow. So people have done a lot of other things as well.
Yeah,
branched out.
Yep, absolutely. No, वो बात तो आपकी सही है. मैं अच्छा, मेरा next question आपसे ये है कि आपने जब, was it always your plan कि आप जब ये जाएंगी pathology, maxillofacial pathology में masters करने, was it always your plan to come back And
Yes.
okay, so you never
Oh yeah,
ended up going for the
because I'm well, like other people say, I have a very unrealistic grasp of reality. ठीक है,
I get that a lot as well. I'm too
yeah.
I'm
So,
too much
so,
of an
so
idealist.
basically, I was going to, and inshallah, I hope I can contribute. I was going to be one of those people who changes the destiny of Pakistan. And I
Okay.
still believe in some way I can still do that and contribute in that. Of course, वो aim itna
Profound.
wo bada nahi tha, but it's there somewhere, like
Yeah.
baby steps, like saving
Correct.
people
I
one pathology at a time.
because I'm just like that. मुझे भी during final year I was like यार dentistry बड़ा मुश्किल profession है, कुछ करना चाहिए. Then this came to फिर ये एक idea मेरे दिमाग में आया था, so I started this. But yeah, same thoughts, Dr. Amber, absolutely 100%. चलें, last question, actually second last question. Where do you see your profession, oral and maxillofacial pathology, in Pakistan in the next 10 years?
Okay, so as of now, I think I only know of two other oral pathologists जो है clinical practice में involved रहते हैं, because both of them work with me, so we're a team. ठीक है, but inshallah I'm hoping at some point we do have a grad program जो allow करेगा हमारी जो new incoming generation है उसको to learn histology and clinical oral pathology, and then inshallah we'll have a lot more oral pathologists who are practicing, and they work with oral pathologists, oral surgeons, just the way you said. And inshallah,
Inshallah, hopefully.
the future is ours, but we just have to jump for it.
Inshallah. Last question, Dr. Amber. What do you think about the startup of ours, and any advice you would like to give us?
Okay, so I think this is brilliant that you're doing this. I wish I had something like this at the time when I was searching for options to get. नहीं समझ आती, ठीक है, तो when you're a kid, you don't understand what you're doing. And I came from a family जहाँ पे वो भी नहीं थी ना, अब्बू मेरे government officer थे, अम्मी मेरी social worker थी, ठीक है, मेरे भाई जो थे, one of them had an MBA, the other one was an engineer. So I didn't really have any guidance. Yeah, we have everything. So yeah, so it's difficult for you to find your way in all of that. But yeah, eventually, inshallah, this is going to help people figure out their ways. It's going to open up options to them. And I think what you're doing is great. And I wish you the best of luck.
Thank you so much, Dr. Amber. Thank you so much for taking time out. शुक्र है हमारा इंटरव्यू हो गया despite the universe completely conspiring.
I'm sorry मैंने आपको गर्मी में बिठाया है.
No, light आ गई थी बीच में when the
okay.
Yeah, light आ गई थी, तो शुक्र है AC चल गया था, वरना बीच में मुझे काफी पसीना आना शुरू हो गया था. But thank you so much once again. I hope you enjoyed, because I really did. And
thank you very much for inviting me. And I hope I was helpful even in the smallest capacity.
No, you definitely were. I am 100% sure. Thank you.